Yes. We say it with one voice.
Welcome. I'd like to welcome you to come out to the museum for our program. I'm going to have Jane start us off, and she's going to just start us off.
Great. Wonderful. Thank you, Beth, and good evening, everyone, and welcome. I am Jane Woodbury. I'm the Vice President of Development at the VNA Care Network and Hospice, and I'm thrilled to see you all here. We are with a collaborative effort here tonight with the Manchester Historical Museum, the Manchester Women's Club, and the Visiting Nurses Care Network and Hospice. And when this idea first came up, I said, would anybody come to hear about the history of the visiting nurses in Manchester? Beth assured me they would, and here you are.
So we're sold out. Other people can't get it.
Well, standing room only, it's wonderful. So we are thrilled to be here and to talk about the history. It is 105 years of visiting nurse service in the community of Manchester. And it was originally started by the Manchester Women's Club. And really, we've had a partnership. It's been working together ever since. So 105 years, and I had to think when I was coming here tonight, I've been celebrating this since the 70th. I was 5. So do the math. There it is. But I do want to thank Beth Wellen, who helped with this PowerPoint. And I do want to thank Christine Gauthier-Kelly. She's a liaison, a link from the Women's Club to the VNA. Also, Del Brady, everyone knows, she had been a former board member of the Visiting Nurses and has been a link to the VNA. And of course, Pat Fenton is here tonight, president of the Manchester Women's Club, and a former president, Beverly Melville, is here. Also, I'm so happy in presenting this program. I'm getting to Lee. I mean, the drum roll is going before Lee here. Because I'm so happy with this because it did bring the opportunity from some of the members before it became the Visiting Nurse Association of North Shore was the Manchester Nursing Service. And Lee Herder had been part of that on the board, and also Judge Ellen Flatley. Now, those two I was so happy to bring back to be readers. They will be readers tonight, as well as Christine, and as well as Catherine Bagney, who's a staff member of the Visiting Nurses. So we're thrilled because there's these documents that we've found, and Christine will tell you in a moment a little story about that. That really was the catalyst for this presentation of PowerPoint tonight. So the reading comes from these actual documents, and feel free afterwards to look in this. It was kind of fun. I actually used that bag in the 70s to see the uniforms. I did not wear that though. But this was my hat. But to see these instruments and see how much has changed. So we hope we can tell you the story tonight about the visiting nurse service here in Manchester. From that time of starting in 1910 to the present time now. And it's very important you know what's going on in healthcare and how important home health and visiting nurses are to you. But I did wanted to mention this document that we found, the Articles of Merger, that Lee Herder's name was on there. And also Judge Ellen Flatley. But there are two others that you may know from the Manchester community. Agnes Barrier, remember Agnes? And Alan Dewey. You probably know Alan. He had been instrumental with the agency at that time as well in doing that. Alan Dewey. Yeah, his daughter lives in town, but unfortunately she was not able to come this evening. So, with that introduction, and have I mentioned everyone, because there are many Women's Club members and other friends here, and we all appreciate you. I do want to turn it over to Christine Gauthier-Kelly, and she'll just tell a little bit of the story about the founding of the documents. So we hope you enjoy the presentation tonight.
newcomers have been in, I think, about 8 or 9 years now. And it has always been that there's been a relationship between the visiting nurses and the Manchester Women's Club. And it was also said, which I found it hard to believe, oh, we started them, you know. And I thought, that's strange thinking. But I couldn't fathom that this could possibly be true till last year when I became the Manchester Women's Club liaison for Dell to the community cabinet, and for the purpose of planning their annual spring gala and fundraiser, which I really recommend you go to next year if you haven't been to it. And I needed to do some advertising and tell the story about, you know, the relationship between Manchester and the VNA. So I called Carol Powers, who's right there. And Carol has been in charge of our publicity in the Manchester Women's Club forever. And Carol said, I said, can I take that article that you wrote a few years back? And she said, sure, you know, you might come on over. She invited me right over, and I think I did hop in the car and go over. She said, I got a whole folder of documents here. There's all these letters, and they go way back in time. I think you'd find them interesting. So I went to her house, and the first thing that fell out in my lap was an amazing letter that I'll read in a little while. Actually, it's part of this. And it spoke so loudly to me as a nurse about what we want in healthcare and what, well anyways, that's all I need to say about that. I just knew there was a gem here and it was something really special. So I took this folder of documents and I brought them to the VNA and to the next community cabinet meeting, and they didn't have them. And Deb Corkin set up and looking for any documents related to Manchester, and I didn't have this piece of history. So here's the presentation. These documents, there was a file folder filled with the early correspondence between the Manchester Women's Club and the VNA subcommittee, which was part of the Manchester Women's Club, and it was the group that was set aside to set up the first visiting nurse. And the presentation tonight is really a culmination of this very unintended journey between the Manchester community, the Manchester community and the VNA. And the letters really tell a great story about the early strugglings of this group to get it going. How are we going to get funded? How are we going to make this thing come up and running? And it's really interesting. So I hope you'll be inspired and be proud of Manchester and the early women of Manchester as you hear this.
Before we start, two things. One, this is all Christine's fault. Okay? I want everybody to know that. She's the one who looked at them and said, we have to do something with them. And this is the result of all that. So when she said the great women and of Manchester, you're one of them. Thank you. This is your baby. It really was. And it was a pleasure to work on this. Secondly, this is our first time looking through all this. And as we were putting this together, there were so many images we wish we had. And we're hoping that with this presentation, people will say, I want to have a picture of that person. We could not find a single picture of the original Manchester nurses. We would love to find those. So if anybody thinks they know, you hear of people in this presentation, you know you have something, please let us know, because we will gladly do it again with more information as we find it. So, with that said, let's get started. And as Jenny pointed out, the VNA Care Network and Hospice, as it relates to Manchester, is actually the fourth name. The very first name was the Manchester Visiting Nurse Association. And that was April 4th, 1910. That's when the Manchester Women's Club voted to start a fund to employ a district nurse. Okay.
At our first meeting in July, it was unanimously decided that the large sum needed could be raised most successfully by sending a written appeal to each resident of the town. These appeals to be in the form of a personal letter, each bearing the signature of the president of the Women's Club.
Can you talk a little louder?
Oh, I'm sorry. Sorry.
Speak slower.
Okay. At our first meeting in July, it was unanimously decided that the large sum needed could be raised most successfully by sending a written appeal to each resident of the town. These appeals to be in the form of a personal letter, each bearing the signature of the president of the Women's Club. The town was divided into 3 districts to accomplish this work, and a member of the committee assigned to each.
So by December of that same year, the bylaws were written and the association got the legal name Manchester Visiting Nurse Association. With the turn of the new year, they hired their first part-time nurse, Miss Laura Carney. That's a person whose picture, or any information we could find.
Yeah.
And this next letter was written by Marianne Cheever, who was secretary of the Visiting Nurse Committee, reporting back to the Manchester Women's Club.
So this is a letter from 1911, shortly after the endeavor began. I think I can hear some of you say that this report does not sound like success. And it certainly does not if we measure success by dollars and cents. It is not a paying business, nor will it ever be. For even if our nurse worked 8 hours every day, it would bring in only $2. And you are all mathematicians enough to see that if every day in the month were filled, it would bring in only $60 or $62. And we found we could not hire an experienced trained nurse any less than $75 a month. But other things count as well as money and are of far greater importance. Your committee have wished a great many times that every member of the club could come into intimate contact with the work and know just what a blessing the nurse has been. One home she went into where a dear little baby came to people who were strangers in a strange land. And every time she came, they kissed her hand and said, "God bless you," in their broken English. The poor little mother had no suitable clothes for the baby, and through the kindness of the Harmony Guild, Miss Carnymore was able to weave a complete set of little garments that the mother could easily copy. She has taught many mothers about proper feeding and care of their children. Aren't you all proud to belong to an organization that has made such a thing as a district nurse in Manchester possible? I am sure that I am. And we must all feel too that a share of the blessing that has come from the sick people who have been helped, the pain that has been lessened and the anxiety that has been shared, is ours.
Now, this is not a Manchester nurse. Some of these images are actually from the VNA's collection, but of visiting nurses of the same time period. But this is what our visiting nurse, Ms. Carney, would have been doing. Okay, their first year is done. And Ellen Clark, who is the secretary of the Women's Club Visiting Nurse Committee, writes one of the first of many annual reports to the committee reporting how they've been doing.
New undertakings require pioneers who, though starting well equipped with the advice and experience of others, must hew their way through their own particular forest of difficulties. 3 nurses have been employed during the year. Miss Laura Carney served as nurse from December 1910 to May 1911. Miss Virginia Sutherland from May to September. And since September, Mrs. Eva McLeod has been in charge of the work.
Okay, at the end of 1912, we get the second annual report stating,
We are pleased to report a very successful year, both from a philanthropic and financial standpoint. The splendid results from the work of the monthly committees for the club in earning money for the support of the nurse have not only settled the question of funds, but also admirably illustrated the civic pride of women when united in a good cause. Insurance companies propose that its clients receive the care of the nurse when needed, the company to be responsible for fees. Later in autumn, the school committee offered to employ the nurse during part of the time in the schools of Manchester.
So by its second year, other institutions had recognized the service that the Women's Club was providing with this nursing and decided to help pitch in. So that helps with the funding. And then in 1913, they decided to become affiliated with the Red Cross Society. And now our nurses were bearing this emblem on their uniform.
We are able to hear Ms. Clement of the Red Cross National Organization for Public Health Nursing explain the advantages of our committee and nursing being affiliated with that organization. Such affiliation will give our nurse the advantage of all the literature published by the National Society, lectures later to be delivered to sectional groups of nurses throughout the country.
And notice the new letterhead. Manchester Visiting Nurse Association in affiliation with the Red Cross. This is a report from 1916, and it records the adding of additional services, including an emergency room and a dental clinic.
This year's great step in advance has been the establishment by the town of the emergency rooms recommended in our report last year. These rooms, with the valuable gifts of surgical instruments and other furnishings made by kind friends, make as well situated and equipped a first aid station as can be found in any town. In many places, rooms of this sort are being used for dental clinics where school children's teeth receive the attention that would otherwise be lacking. They are also used for minor operations, such as the removal of tonsils and adenoids.
And this clinic was in the old town hall. Couldn't find any pictures of the clinic itself, so please go hunting for your photographs for your clinic exhibit. This is the old town hall for the new one. And also, in that same annual report,
That all the good work done in our town, such as health lectures to the young girls in the Arabella Club, the work of the doctors, nurses and teachers in the public schools, and the daily service of the nurse in the homes, is bearing good fruit, already proved by the fact that there isn't a single case of lung tuberculosis in Manchester at present. Busy, well people, engrossed by everyday cares and responsibilities, little realize that, even in a town of Manchester's size, there are always households afflicted with illness, as the number of Miss Long's visits will testify. During the past year, she has made a total of 1,508 visits. Out of these, 1,051 have been nursing visits. Certainly a blessed service, and one that must be far-reaching as a civic benefit to our town.
okay, now remember, it was only 1910 that we started this idea in this service. 1918, only 8 years was the great flu epidemic. Can you imagine what it would have been like if we didn't have this in place? Manchester Cricket was quoted, "It is impossible to gauge in any way the amount of loss and suffering saved to our community by all the care and nourishing food so seriously needed as given from our nursing service." Now, during that flu epidemic, which was worldwide, many halls and auditoriums were converted into hospitals. And this is a picture of one, I think, in the Boston area. Here in Manchester, our old horticultural hall was converted into a hospital. And what you see in this picture is the doctor and some of the nurses. This picture is Dr. R.T. Glendeming and two of the nurses. I don't know their names. But notice on the side of the building here. This is where Essen is right now. Was tents, the overflow, or the extra sick that they didn't want in the building. And on the back of this picture, it lists the names of the two nurses. Some of you may recognize these people and may know more than we know. Miss Dorothy Spry and Alice Hindenburg.
Yeah.
Oh, I heard names, people know them. At the end of Canterbury?
That would be it.
Oh, yeah, it could be. Yeah, it's hand script. Oh, that's a good correction. The end of that year, and the annual reports were written at the end of December. So that annual report states a very different type of report.
It is impossible to say, as in our past 8 reports, that we have escaped serious epidemics this year. For in common with the rest of the world, we have suffered the terror, losses, and sorrows of the dreadful influenza, now happily past. Every community was suddenly confronted with unthought of problems of caring for the numerous sick and feeding the helpless. In most towns, these heavy burdens fell upon the visiting nurse committee, united with the boards of health and aided by bodies of organized volunteer workers. Here in Manchester, the food was supplied from the food center and the dangerously sick were cared for at our emergency hospital, both of which were established and supported through the public spirit and generosity of Mrs. William Hooper. This enabled Miss Long to entirely care for the home patients, aided by one of the hospital nurses and volunteers who distributed food under her direction.
And also in that report was a news clipping that they wanted to share.
And this passage really depicts what the nurses might have found in those days. A man who used his automobile to carry nurses from house to house during the recent epidemic in Boston tells of finding in one apartment house a husband and wife and one of their children all confined to bed, the 3 having had both influenza and pneumonia. And on the floor, getting along as it could, was a lone baby, as yet untouched by the malady, but in a pitiful condition from lack of care. The thought of that little creature cooing at us and then crying again as we entered, says the gentleman, haunted me for days after we found it. And he adds, the helpless distress of that mother for her little one made my heart ache when I heard of her death. The memory of what the nurses did for that family and the baby in particular was mighty good to think upon.
The following year's annual report had this one paragraph, because of course the conditions of the epidemic did carry over into the winter a little bit. But the following year, you see this one paragraph, Miss Long's labors during December, January, and February were so exhausting that she was obliged to take a month's rest, where she was replaced by a substitute. By 1919, the town steps in, realizing how much of a service we are providing, and they start helping to pay for the services. This is a picture of a VNA nurse, we're not sure what town, doing posture checks. Again, at some sort of clinic, you see the posters in the background. But posture. In 1920, the annual report has this paragraph, arrangements were made with Mr. Boyle to let Miss Long have the carriage 1 day per week during the summer when, in her judgment, it was needed. So, the visiting nurse needs somehow to go visiting. And each subsequent annual report recommends that they consider purchasing a vehicle of some sort for the nurse. It was not until 1934 that Manchester did purchase an automobile for the nurse's daily use. But it was permitted that she preferred her bicycle. I have a great picture here, and it says visiting nurse service, but this is actually the Topsfield visiting nurse. I don't have a picture of the Manchester one, but other towns recognized the need and did purchase vehicles for these traveling nurses. We have been doing so much that it was recognized that maybe we needed to divvy up some of the responsibilities.
Since the institution of the welfare department in town, many calls that were looked after by the association, especially in regards to food and clothing, are now cared for by that department.
So a little off the plate of our traveling nurse. In 1935, Mrs. Helen Poole joined the staff part-time. And this may be a person people remember. We're desperately looking for info and pictures. By the 1940s, she became the head nurse, and she is running this organization's medical services. And one of the reports at this time says, you may also be interested to know that Dr. Archibald, District Health Officer, stated that Manchester led the state in immunization against diphtheria. Only 3 children entered school last fall who had not been immunized. In 1952, the Manchester Visiting Nurse Association, under the Manchester Women's Club, decided to merge with the Public Health Service of Manchester and the School Department of Manchester to become the Manchester Nursing Service.
I move that the Visiting Nurse Committee of the Manchester Women's Club be discontinued at the annual meeting on April 15, 1952, and that, at that time, all monies held by that committee be turned over to the Manchester Visiting Nurse Association, the officers and directors of which shall be chosen from citizens of the town at large.
And so, the official Manchester Nursing Services Incorporated is formed, and I'm going to read off the names of the trustees at that time, because these may be names that are going to be recognized. Benjamin Huntington, Elizabeth Hines, Harry Slade, Helen Mitchell, John Cullinane, thank you, Cullinane, Abby Eaton, Eric Erickson, David Gaunt, Robert Cooper, Marion Knox, Alice Thorndike, Ann Willis, her neighbor, Janet Roble, and Deborah Young. Okay, and from this point on, it is its own legal entity, the Manchester Women's Club. You've done your job, gave birth to this wonderful institution, and it has now grown up, and it's independent. This is a flyer of their services that they offered: testing for diabetes, oral cancer, auditory testing, spring clinics, and they ran their own fundraising programs. Here's some more. But by July 1979, there's discussion of whether or not merging with other similar organizations would be of benefit. And so it was decided that Danvers, Beverly, Cape Ann, and Manchester would all merge in 1979 to become the Visiting Nurse Association of the North Shore. And from that point on, here is the official merger document that Jane was talking about with those 4 organizations. And at the annual meeting for the Manchester's Nursing Services, this was
During our March meeting, the Manchester Nursing Service voted to merge with Danvers VNA, Beverly VNA, and Cape Ann Community Nurses, Gloucester. This is not the end of all efforts, it is a new beginning. It will now be important to assure that the quality and availability of service to our community not only remains the same, but increases according to our need. I am not a believer that bigger necessarily means better, but I do feel that continued and expanded community health services can be offered to the Manchester people in a more available and efficient way by sharing services and expertise.
Okay. Now, what's the VNA's part of the story?
So here we are in July 1979, and at that point, you know I'm a registered nurse. I've been a community health nurse for the Beverly visiting nurses, so I became getting to know people from the Manchester community during this process of the merger in 1979. So here you might recognize our very own Lee Herder, who was there, and Alan Dewing is right in front of her. Lee had been the corresponding secretary at the time, and Alan was the recording secretary at the time. And really what prompted this particular merger was just changes in regulations that the nursing service had to abide by, and by coming together, horizontal integration with like VNAs, we were able to meet those needs and meet those regulations. And at that time, I had mentioned before that Judge Ellen Flatley was involved in signing that document, as well as Agnes Barrier. Next slide. So during this time in the early 80s, the office, we've always had our office at 8 Angle Street in Gloucester, but to accommodate all the new staff that had come together from these agencies, we had an office in the Cumming Center in Beverly. Now that was before it was nice, before they renovated it. It was we were excited, we thought we could get discount shoes there. This was where they made machines that made shoes, and it wasn't that great a play, right? But anyway, that's where we were. But at that time, because we were larger, we were able to do some more innovative programs for the community. And we did start a summer therapy program for disabled children. We got involved with more of a SIDS program. Do you know what SIDS, sudden infant death syndrome? There was a lot of concerns about. And we also started an industrial health program for businesses, employee health. So next slide. So in the 1980s, people might recognize that woman. She's a Manchester person. We started the Elder Keep Well clinics here in the community of Manchester, and these still go on today. So I hope people know about this, that it's every, the first and third Thursday of every month, 10 to noon, and it's held right here in the Manchester Congregational Chapel. So there is information that we brought with us with our phone numbers that people that want to call and make appointments to come to that. It is a service that's open to people 60 and over in the community. Next slide. Now we're getting into the mid-80s, and again regulations was asking us to provide service 7 days a week and into the evenings, so we need to make changes for that. We needed to meet people's needs with IV, intravenous therapy. We were doing that now in the home setting. And also we had our first ventilator-dependent patient in the home setting. So as you know, sometimes with patients and all, they would die or be institutionalized. Now with medical advances, people were able to live and were brought home. And then our nurses need to have the skills to be able to care for these people in the home setting. And again, we had to deal with changes in reimbursement. There were changes in Medicare and the interpretation of Medicare. We were the bearer of the news to people in the home setting. Now, also during this time in the 80s and the 90s, I had the pleasure of working not only with members of the Women's Club, but also a group that was called the Manchester Friends. And we would meet periodically during the year at Annette Olney's house on Old Neck Road. Ann Willis, who lives next door here, was a member of that. Ann was a good golfer, and she would tell me about golfing. I told her I'd let her know as soon as I broke 100. And Ann, I haven't done it yet, not for 18 holes, but for 9 holes. let me park in her driveway and walk down to Singing Beach a couple of times, so that was wonderful. But there were so many people involved with that: Gert Brown, Eleanor Hatcher, Del Brady, Alicia Parker, Peggy Gilmore. I don't know if anyone here had been a member of that group at one time, but a lot of great people involved. Alan Dewing had been a Manchester friend. And we did things like we participated in the Manchester Sidewalk Bazaar. We had raffles, and we did the lobster rolls. Remember that? And that was great. And then for many years we did with the real estate company here in Manchester, Coldwell Banker. We did the phone-a-thons. You may have received a phone call from us, but it was from somebody in Manchester calling someone in Manchester, and that went on for many years. So that was very helpful to sustaining the organization. Next slide. Again, with all these reimbursement and regulation changes that are imposed by third-party payers, Medicare, Medicaid, all of this, we had to make changes again in order to survive, to be fiscally solvent, to be able to provide innovative services to the community, to really meet the needs. So we did more, our board believed more horizontal integration with like VNAs, that we would stay community-based. So many other different mergers. In 1995, the VNA North Shore then officially became the VNA Care Network and Hospice. Then there was another merger with Central Massachusetts and Worcester. And then we did bring in, although we had hospice in other parts of our service area, we brought in hospice in people's homes because a payer referral source had asked for continuity of care for home health to hospice, and we expanded that service here in the North Shore and Cape Ann community. And then just most recently, we had merged with the VNA of Boston, which actually is the oldest organized visiting nurse agency in the country, starting in 1886. Even that was after the Manchester Historical Society was established. And that again, it was just meeting all those regulations, reimbursement, and being able to survive. And this really has brought us today. We are the largest visiting nurse agency in New England. So you can see the impact and the vision from Manchester Women's Club, Women in the Community, from Manchester to now a larger organization that we are nationally known and recognized. Next slide. Pretty good for a little town. I agree. So now with healthcare today,
It's all the views of Manchester. Start changing.
well, a lot to be proud of. So today with healthcare, the home is the center of healthcare. You're not long in the hospital if you even go to the hospital. And physicians and hospitals now are penalized if somebody has been in the hospital and has to go back within 30 days. So the business is booming. We have grown about 25% because we work with area physicians and hospitals, Boston hospitals, and home now is the center of healthcare. And again, with healthcare reform, with Massachusetts people having healthcare insurance, although there are many gaps in what that does cover, but also technology. From when I was doing the visiting nurse work, the paperwork was 2 pieces of paper. One, who lived in the home and what the dog's name was, and then what I did. But now we will see in a moment what the tools are today and just the intricacies and the documentation for this. So there's been many advances in medicine, and with that, we have had to change and grow and have innovative services to meet that need. Next slide. So an example of that is with telemonitoring. Because now we provide service 24 hours a day, 7 days a week, and we have just as many patients evenings and weekends as we do during the week. So instead of people being in the hospital, the old days people were home Monday through Friday, and then now really it's in the home setting. So with this, we've had different technology. We have telemonitoring, where we're able to monitor patients every day if needed, or according to what they do need. Their vital signs, reminding them to take medications, reminding them about their health care, their diet, and so forth. And it's just an efficient way to take care of more patients in the home setting. And it does help to reduce emergency room. You don't want to go to the emergency room unless you really have to. Try to keep you out of that. And also to prevent hospitalizations and rehospitalizations. Next slide. So another change that we have seen is with therapy, physical therapy, and a joint replacement program. Everybody's getting new body parts all of a sudden, new hips and knees. I mean, it's amazing what they can do out there.
Or repaired old ones.
That's right. And with this, some patients don't have to go to a rehab or a nursing home. If they meet a certain criteria, you can have the surgeon and go right home, and our physical therapist will care for you, because most of us really would rather be in the comfort of our own home. Don't you agree?
Yes.
Other new programs, a behavioral health program. We have over 70 different programs and services to offer the community. And I'm so proud to report that we just heard really the star rating on a national basis of our agency with other home health visiting nurse agencies across the country, that we're in the top 20%. And that's about quality of care. So we're thrilled to report that to you tonight. And that's the last slide. And again, just in acknowledgement to the Manchester Women's Club, here they are at a recent luncheon, and the tray presented to them, because look at the history of women, and we do like men too. We do welcome men and meet men in our friends groups as well. Pass that around, but really, there's been so many changes that you've seen in this program, but what hasn't changed is the need for volunteers and community support, and that has been a constant throughout our agency. So we do much appreciate that, because it really helps us with the mission of caring. And what a wonderful story from the beginning of Manchester Women's Club to now, and what might be going on in the future with the different innovations in healthcare and keeping people in the community healthy. And just in closing, I do want to introduce my colleague, Paula Schultz. She's our Director of Clinical Services, and she's going to demonstrate what it's like being a community health nurse today.
Thank you, Jane. So, I'm the nurse today, and I'm getting ready to come out to see you, so I would need to call you on my phone. And also on my phone, I could see some documents that have been scanned to me about maybe you were in the hospital and the doctor gave some orders. I would be able to see that. And I would arrive at your home with my bags. First of all, I introduce myself, and I'd have to have your record. Now, Jane said she had what, two pieces of paper?
It's in the 70s.
Yes.
Try that today.
So, I would have your record, and many other patients' records that I would be seeing on my laptop. And I could see if you had a physical therapist seeing you, an occupational therapist, I would be able to see everyone's documentation, so I would know what the therapist did with you. And also, right? So then I would be saying, okay, let's get ready to bring out some of my things that I'm going to be using to assess you today, because we're going to do a head-to-toe assessment. We're not going to leave any part out. And the other part is I'm going to ask you to bring all those medications that you're currently taking or kind of have in your closet that, oh, I'm not taking this now, but I can't throw it out. I want to see everything, and we're going to go through all those medications, and we're going to take detailed information about that. And when I'm gonna put it in the computer, and I'm going to be able to know if there's any interactions with those medications that we should be aware of. You know, sometimes we get prescribed a lot of things, and one thing doesn't always make the other thing go well. So let's see, I've got to be ready now to get my equipment out. I do have soap with me, and I have paper towels. But now, in this age of using a lot of hand gel, I might be using my hand gel sanitizer quite a bit. So I'm going to leave that out because I'm going to need that a lot. I'm going to get wipes out because every piece of equipment that I use on you, then I'm going to have to wipe it off before it goes back in my bag. Well, look at, here's a thing that hasn't changed too much over the years. The stethoscope. That's probably pretty something, you know. You're gonna use that. And as you saw, the blood pressure cuff, which is in here. Yes, here we go. There's the blood pressure cuff. I'm going to need that. And we're going to want to check your oximetry. We're going to want to know how your oxygen level is. So I'm going to need that. And when we talked about your medications, and I looked at your information that I got from the doctor, you were on Coumadin or maybe another Lovenox, one of those blood thinners, and the doctor wants me to check your level of bleeding time prothrombin and report it to him so he can adjust the medication. So I can do that with my little point-of-care machine. So I'm actually going to test your blood and be able to report back to the doctor. So I carry that all the time too. And oh, by the way, when I looked at your leg, I saw a little wound that I wasn't, ooh, yes, okay. So I'm going to take some photos with my phone, and I'm going to send those photos to our wound care specialist nurse back at the office, and she's going to look at those and help me decide what we're going to ask the doctor that we're going to put on those wounds. So I do have a thermometer with me, but it is digital. And if I have to give you an injection or anything, I will be disposing of those syringes right in my little red bag here. Hazardous. It has a little hazardous thing on it. So we're going to do that head-to-toe assessment. All our nursing staff and all our staff really have to be highly skilled. It is staff that come to us go through up to a 6-month orientation. And it really does take a long time for people to be ready to go out and face anything in the home. As Jane referenced, we're doing a lot of things at home now. You know, people don't stay in the hospital, they don't stay in the rehab or the skilled nursing facility that long. They come home to us where they should be. And we are doing a lot of procedures at home that we didn't do 20, 30, 40 years ago. Intravenous therapy, a lot of complex dressing changes. Some people are actually on machinery to help take the drainage away from their wound. We call it wound vac therapy. And we really need to have our staff be able to handle all of this. So they need to have special instruction, and we need to make sure, because they are in their home by themselves, it's not like being in a hospital where you can say, can you come and help me do this? Right. They have to be independent practitioners. So it does take a lot of time for them to get oriented, and they need to know how to do all kinds of assessments, because for Medicare, our reimbursement is based on how well we assess you and set up your plan of care. And setting up your plan of care well will make sure that we have a good outcome for you Jane spoke to how well we are rated under Medicare, which is we're in the top 20%. So I thought it would be a hoot to see the nurse of today. So I think we have Beth is next to kind of wrap us up.
Okay, before we close, we just want to say thank you for coming, and I hope that you found this as interesting as we did. We just had so much fun reading through these documents and tracing back the history from the very first visiting nurse and to, that was cool, I love that. You know, what's happening today, and we as a museum are just thrilled that we could be part of that, and we are now the caretakers of the Manchester's Division of Documents, and there is this display, and the V&A provided all of the old medical stuff, and they just announced that they're going to let us keep it for a week. So if you want to come in and look at it during the next week or so, we'll be here until, I think, what, next Friday, you said? And we're going to close with a part of a 1920s annual report from the very back in the beginning, the Manchester Visiting Nurse Association. And we thought it was fitting to have Judge Ellen Flatley, who was one of those trustees signing off Manchester's role, close us with this. Question? Oh, and afterwards we'll have questions.
I think you'll find these words very moving. When and wherever there is life to be tended, nourished or nursed, educated or saved, whether the life be yet unborn or newborn, senile or ill, there is the field of woman hard exercising its great function of foster motherhood. This great function of foster motherhood has been gradually emerging more clearly as a new profession, the profession of public health nursing, and the nurse is truly named the foster mother of the race.
May I ask a question?
Yes.
I didn't hear, my grandmother was a midwife from the time she was about 20. She came over from England where she got her education. And I don't hear anymore about midwives who were very active. In fact, the history book up there in Vermont, up there in Shoreham, on Orwell, close to Rutland, Vermont, has her in there as birthing 3,000 children in a place that's maybe twice as big as this room. And but it was more than that. If you got your finger caught with a fish hook, you call the only medical person in town, and she wrap it up and tell you go home. She did everything like that, and yet I don't hear about that anymore because they weren't professionals, I guess, but they were certainly necessary, not only in New England but more so in the Midwest. Yeah.
In some communities, as you read the old histories,
There
were
must
the
be
only
history.
medical people in town.
There must be history of.
Aren't there still midwives now?
Oh, they are.
Oh, yeah.
Yeah, Beverly Hospital is the birth center. That's why we have a birth
Why would a woman be sent to a birthing?
They're not sent, they choose to go.
They choose to go. They have
They're a
a choice.
hospital, they have a choice.
Adele.
I am the beneficiary of the visiting nurse in 2013 and 2014, and I am here to attest to splendid service. And I had to be in a nursing home for a while, rehab, and then I came home, and it was beautifully handled. Very good people involved, both the visiting nurse service itself, and then the people who came as part of the rehab. It was very, very good, and I'm now 91 years old, and I'm still going.
Well, they have their own.
Oh,
There
okay.
are
I had a knee replacement.
other home health agencies, just like there are multiple restaurants, there are multiple home health agencies.
So how do you get Visiting Nurse Association to, I had my knee replacement, I had to have,
You can ask for us by name, VA Care Network and Hospice ask for us by name. People do have a right and a choice to choose, and you can talk to your physician if you're coming from a physician office setting, or you could talk in the hospital with the discharge planner, the coordinator, and
because I can't
if we have a preference of a home health agency. Yep.
Question, does every VA visit have to have a doctor's order, or can you just call the phone and ask for help?
Yeah, you can call, and our referral center staff will talk to you about your situation. But in order for us really to go into your home and provide any service, legally, we do need a doctor's order for visiting nurse service.
Jane, can I say one more thing about that? Because I think it is very confusing for the public to understand that this is, unlike what that quote said, this is a huge business now. The idea of medical care in the home is huge business. And so there are a lot of organizations doing home health care that replicate essentially, it's nursing care at home. But I like to think that there is something gained from this 100 years of experience that the VA Care Network and Hospice has. And how many communities also has this grown to be? I wanted to ask that question. Because now with the merger through Boston and all of that, how many communities do you serve?
As I mentioned, we are the largest in New England, and it's probably over 200 communities. But we try to keep the local presence by having our office in Gloucester. We have an office in Danvers and have served the community. We have a North Shore Community Cabinet group, like the Manchester Friends. We're always looking for volunteers if anyone is so interested, and trying to keep the local flavor through things like this, and just letting people know the linkage with the community.
I gotta mention one more thing. In this room, a recent member of this organization is Susan Parker, and she has just joined here, and you guys put her to work. She's Shirley Wilkinson, a longtime nurse. Shirley lives up the street by Foreign Affairs Restaurant, and Susan and her husband Jeff have recently moved in across the street, and they own that house on the corner. It's a historical house on the corner opposite the gas station, corner of Summer Street.
And Susan, you're a retired nurse, aren't you?
Yes, but I never had the opportunity to be a VNA nurse,
Never had the opportunity to be a what?
a visiting nurse.
Oh, okay.
She had half of Maine, half of the state of Maine. All small towns, and Jeff could never find her. She was serving somebody.
Any other questions or comments? Yes.
I'm very old, so I can say this. I was a visiting nurse in the days before we had disposable. So how did you think about going into a home with a little black bag, and nothing like this lady had here? I had blood pressure cuff and stethoscope, lots of newspapers, because we couldn't sit on a chair in a home, whether it was clean or not. We had newspapers on the chair and put our stuff on the chair. But anyway, we had no disposables, and we had to change a catheter or do dressing. Just use your imagination for that. Coffee can came in very handy. Well, nurse on hospice. I don't know if you ever heard of that. They call nurses on hospice in Kentucky. That's their own occupation.
Frontier Nursing Service, yes.
Long time ago, Washington, D.C. wasn't the best place.
Any Well, in that case, I'm